We learned that Coach Prime fought bladder cancer for most of the summer. In the words of his doctors, quote, "It's beaten." He says he expects to be on the field in time for the college football season, maybe with a porta potty on the sidelines.
Our medical expert, Dr. Pyle Coley, is here this afternoon to talk about Coach Prime and what we know about his cancer and his treatment. What can you tell us? And you've looked into this a little bit.
Yeah, so during the press conference, his doctor told us that his cancer was caught in the early stages. She said that it was a high risk, but it hadn't invaded the wall of the muscle yet. So the way you sort of think about bladder cancer is three stages. One is it's just inside the lining of the bladder. The second is it's gotten into the muscle. And the third, that it's metastasized. So he had sort of the earliest stages of the bladder cancer just inside the lining. And he could have actually treated it with what's called a bladder sparing procedure, where he gets chemotherapy and radiation. But he decided, because of his doctor saying that it's a high risk of recurrence, to just get rid of the complete bladder. So according to his doctors, he's essentially sort of cured of the bladder cancer.
So because he removed his bladder, what goes in the place of that? How does somebody function after that?
So they put what's called a neobladder. So they take a piece of your small intestine, about 50 to 60 centimeters of your small intestine. Now your intestine's a tube, right? And your bladder is more of a pouch. So they slice open the tube and they reconstruct it into a pouch. And then they put it where your bladder goes and attach the ureters, which are the tubes from the kidneys to the bladder that essentially drain urine into it. But here's the thing. It's not a bladder, right? And so it doesn't have a muscle in it. So it doesn't quite function in the same way as a bladder. It's more just like a pouch that's sitting inside, which means that he's going to have to change the way that he sort of thinks about urinating and getting the urine out. But the good news is he doesn't have to wear a bag or have a catheter in all the time.
That was my first question. So when he says something like there might be, a porta potty nearby, so
right,
does that mean you go more frequently or you don't get that sensation? We're asking all these, personal questions, but I think people are curious.
Exactly right. So you do not get that sensation because that pouch that you've put in there, which are the intestines, doesn't have the same kind of nerves in it. So you just have to sort of think to go regularly. And the way that you go is very different, because when we go to the bathroom, we actually squeeze our bladder. We relax our pelvic muscles and squeeze our bladder. That empties it efficiently. He's just going to have to relax his pelvic muscles. So sometimes you actually do have to follow that with something called self-catheterization. We have to put a catheter in to make sure there's not too much urine being left behind. You also get a lot of leakage. You can get incontinence with it, obviously, and he had even made a joke about being dependent on Depends. And you can have a high risk of infection. So he has to be really careful. Not only is he going more frequently, he's changing the way that he's going, and he's much higher risk for urinary infections as well.
So I'm sure there's a lot of lifestyle changes there. For other people out there, and I know you touched on this, but if he didn't opt to get the bladder removed, he would have undergone how much chemotherapy? Is that always the second option?
So what they would have done is put a catheter into the bladder and kind of sliced off the tumor or the cancer, sort of eroded it down, then put into the bladder intravesicular chemotherapy, which is chemotherapy into the bladder, which is nice because you don't necessarily have to have systemic chemotherapy. Also something called BCG, which used to be used, as a TB vaccine, but it stimulates the immune system. They may have followed that with radiation. So this is called a bladder sparing surgery. In the early stages of the disease, some people might have elected to do that. Obviously, the risk of recurrence, if it's a high risk type of a cancer, is higher, but you still have your bladder cells there. But I think he took the definitive option. Right. Regardless, he's going to have really close follow-up. Even though he's now lost his bladder, there's still those types of cells in our urethra, which is the tract where the urine comes out of.
I know prostate cancer, colon cancer, those are prevalent in aging Black men. Is that the same with bladder cancer? Are they more prone to get it, or is it just for anybody?
So for sure, men are more prone to get it. We think the androgens actually promote bladder growth. We also think men excrete toxins in a different way. So our bladder accumulates toxins that our body's trying to get rid of. So estrogen tends to protect female bladders more than men. So men tend to get it more. Women tend to get it in later stages. White men tend to get it more than Black men, usually due to exposures like smoking, workplace exposures. But when Black men get it, it usually tends to be in an advanced stage. So I'm actually sort of relieved that we found this earlier, which is, as he had said, a wake-up call to normalize the conversation around cancers, especially bladder cancers, prostate cancers, and urogenital cancers.
Wow, great information. Very informative. Dr. Coley, thank you.